Right. Thank you, Laura. It's a pleasure to be back. Here you are in the middle of your sixth year of this excellent program, with more to come in 2025 and going into your seventh year. So, along the way, I've had the pleasure of talking about hypophosphatasia, skeletal fluorosis, dense bone diseases, and the heritable disorders of rank OPG, rank ligand, NF kappa B signaling. And those were pretty, I'd say, standard presentations. This one's going to be a little bit different, but I think you'll find it of interest. I chose to title it Phosphorus, Rare Bone Disease History of It. Now, maybe something that's no longer a worry, but as I'll show you, gave us clues to what are currently worries. So I think you'll find it of interest, and it's going to be in sort of two phases. The first, where I describe phosphorus and its history to you. I'm a bit of a inclined to be pedantic about all of this because I'll be challenging some of the phraseology, the labeling that we use. But then I'm going to turn to disorders, and I think you'll find that interesting, maybe even more so. So here we go. And in a sense, it starts last Monday when I got this email. Dear Dr. Whyte, thank you for the article you sent. As many of us with HPP, hypophosphatasia, are getting older, is there any correlation of the elevation of phosphorus? My last one was 5.3 in the development of coronary artery disease. I will forward two articles about phosphorus and coronary calcification. So I read this and I see the words phosphorus, phosphorus. And to talk about rare bone disorders and get the labeling historically and currently correct, I see phosphorus, which I know is, in a sense, incorrect. And toward the end of this talk, I'll tell you about spontaneous human combustion. Is this pseudoscience? Is this something rare? If you go on the internet and you start reading about this thing, maybe 200 cases reported over the last 200 years, you'll get a sense of what some think might be a real entity. But when I actually gave lectures on mineral metabolism to the second year medical students here at the Washington University School of Medicine, I sort of, maybe incorrectly, but I was trying to make the case, said, if you had elemental phosphate in you, you might burst into flames. And then I find this is maybe some support for that kind of notion. But what I was aiming to do was give him a simple lecture about mineral homeostasis. And if you look at Chris Nordine's book from 1976, it was properly titled as Calcium, Phosphate, and Magnesium Metabolism. That's how I saw the better way to refer to what we're dealing with clinically, not phosphorus like in that email, but phosphate. So why is there confusion? It apparently goes back, it'll be a century next year, a couple of weeks, to this very important paper that appeared in the Journal of Biological Chemistry back in 1925. And here, Fisk and Subarow reported, as you see in the title, the colorimetric, I should say, determination of phosphorus. So are they actually measuring elemental phosphorus? No. If you go and you look at the first line of their abstract, they're talking about a method by these folks here for the determination of phosphate. So here starts perhaps some of the confusion between what are you actually measuring in clinical medicine, et cetera. Are you measuring phosphorus? No, you're measuring phosphate. So the problem, I think, persists for the last 100 years in the nosology. Then you go back and you look and you find in the JBC Centennial Celebration, 1905 to 2005, they're talking about this publication as being monumental in biochemistry, the determination of phosphorus and the discovery of phosphocreatine and ATP, these phosphorylated high energy compounds being the work of Fisk and Subarow. And they cite the first paper that I just showed you, the colorimetric determination of phosphorus back in 1925. And then they say, oh, look, what is it? 4 years later, 1929, they're discovering phosphocreatine. They'll discover phosphate as part of ATP. So these are seminal papers in the history of phosphate phosphorus metabolism. But again, they're talking about here in the first paper, the colorimetric determination of phosphorus. So we're familiar, all of us who are clinicians, with hypophosphatemia. And I was curious in preparing this lecture to see just how prevalent this switch of talking about phosphorus or phosphate is for us. So I look at the text, the books, and I see Dorland's 26th edition. That medical dictionary, the one I had, was 1985, and it correctly talks about abnormally decreased amount of phosphates in blood. That's what hypophosphatemia is. Then you go to Stedman's medical dictionary, 26th edition. This is 1995. And it talks about hypophosphatemia being abnormally low concentration of phosphate in circulating blood. So I say, good. Then I look at the Merck manual, professional version. They're talking about hypophosphatemia. Good. Wikipedia. Good. Then I go over to Medline Plus, and it gets a little bit maybe dicey. They talk about hypophosphatemia, meaning low level of phosphorus, parentheses, well, phosphate in blood. And then I wanted to see how we're doing things here in St. Louis. So I call the laboratories, the clinical labs at Barnes Jewish Hospital, and I say, how are you reporting out in your renal panel? And they say, well, we report phosphate. Then I call St. Louis Children's Hospital right next door, and I say, how do you report it out? And they say, phosphorus. And then I thought, we like to work with Mayo Clinic laboratories concerning hypophosphatasia. Their alkaline phosphatase and their pediatric phosphate levels are wonderful. So I was going to go back and see how they're referring to things. And you look on the internet for their laboratory and click under P, and you scroll down and you come to what? Phosphorus. Oh, inorganic phosphorus, serum. But then if you send them a 24-hour urine, you collect some feces, you do a random urine, they're reporting out phosphorus. So we're 100 years later, there's still some confusion with how we refer to what becomes of the element phosphorus. And then, yes, for this echo program on rare bone diseases, well, we certainly have plenty of disturbances in phosphorus, if you like that definition, or phosphate homeostasis. And A is the Mendelian disorders, the autosomal ones. We'll start with that email from that doc, hypophosphatasia, yes, elevated levels. But then you've got hypophosphatemic rickets, autosomal dominant, two forms of autosomal recessive, hypophosphatemic rickets with hypercalciuria, hypophosphatemic rickets with hyperpara, and autosomal dominant hyperphosphatemia. So look at the way they're being referred to, hypophosphatemic, and many of them that come into our space of rare disorders. Of course, there's also the X-linked ones among the Mendelian disorders, and the most prevalent is XLH, hypophosphatemic rickets, X-linked dominant in the online Mendelian inheritance in man, and then there's an X-linked recessive form. Not rare in the sporadic category is hyperphosphatemia of chronic liver disease, but then, yes, we could say tumor-induced rickets or osteomalacia with its hypophosphatemia is common. So yes, our work is full of these kind of disorders, Mendelian or sporadic, where you want to understand what's actually being measured, what's actually being referred to. Then we go to the periodic table of elements. What about this phosphorus? What about this phosphate? And you see upper right-hand corner, there's P for the 15th in the periodic table, and that's referring to the element phosphorus as capital P. And yes, it's number 15. It's got 15 protons, it's got 15 electrons, 16 neutrons, and that is the element phosphorus. Then from moving forward with this talk, and I think in chemistry in general, of course, capital P, like in that table, refers to phosphorus. And where does the name come from? Apparently, the ancient Greek, where phos means light, and for us, bringing. So, bringing light. Why did it get that name? I'll show you why. I sort of like at the bottom, translating the Greek for us, bringing to FORUS, for us. Is it actually talking about bringing light for us as phosphorus? So that's the origin of the name of the element, but I'm going to show you how we got to appreciate it as light bringing. And here is a nice representation cartoon about number 15, phosphorus. And yes, it's light bringing. So what is this youngster holding? A match, staring at it. And if you look at the red at the bottom, it says it is the red phosphorus in match tips that makes it ignite. So it brings not only light, but it brings fire. And this is going to be important for how we got to recognize the rare disorders that I'll be talking about. So other definitions, phosphorescence is really nothing to do with phosphorus. Other types of elements can fluoresce. A fish can fluoresce, but this is not due to phosphorus. Phosphorescence refers to readmission of absorbed light, whereas phosphorus, the element, is luminescent. You can see it, or phosphorescent, because it glows, but it also bursts into flames. So you've got these definitions to deal with. And the start is really quite remarkable. How did we get to the number 15th in the periodic table? You would have thought, based on the development of true chemistry, that maybe it would have been in the middle of the last century, the late 1800s, that phosphorus would have become recognized, but no. It was much earlier on, and that's thanks to interest in alchemy. It's 15th in the periodic table, but it's the 13th element to be discovered. So when was that? I'll show you. But along the way, appreciate that elemental P, elemental phosphorus, does not occur naturally. It's too reactive. It's almost like fluorine. It's too reactive, and naturally it occurs only in an oxidized form, and that's phosphate. So you could talk about now phosphate as being inorganic phosphate, and the abbreviation then would be PI. Environmental phosphorus is really PI, inorganic phosphate. And I take you back to that textbook from 1976. It's considered a mineral, and I think all of us understand why that would be true. But then biological phosphate is also sometimes considered organophosphate, PI, but within an organic group. And you go back to Fisk and Subarow, and there's ATP creatine phosphate as high energy phosphate compounds, one example. And there's also our friend, the third high energy phosphate compound, inorganic pyrophosphate. So I'm going to end up concluding this lecture talking about inorganic pyrophosphate as well. But these are the biological phosphates by definition. And then it's also important as we start talking about white phosphorus on the left, the four green circles. White phosphorus is also sometimes called yellow phosphorus. And then on the right side, you've got 8 phosphorus atoms combining to make red phosphorus. And how can this be? It's important for understanding the story as I go along. These are called allotropes of phosphorus. So at the bottom, what's an allotrope? These are different structural modifications of an element. The atoms are bonded together in different manners. And what I'll be telling you about is white or yellow phosphorus on the left, that allotrope, and the misery that it caused. But in comparison to the right side, red phosphorus, and how that became incorporated into what we now use and call safety matches to light fires, etc. So allotropes, an important concept when you're dealing with phosphorus. And then, yes, we've got inorganic phosphate, but we also have the element itself, phosphorus. There's the natural presence is going to be PI only, phosphate. But then you get going in industry or in the laboratory, not necessarily the clinical laboratory, but laboratories, industrial laboratories. And now you're dealing with an interest not only in inorganic phosphate, PI, but also the element itself, phosphorus. And this is now going to be the theme of probably the next 25 minutes. So this is beautifully described in this book. It's I think, about 250 pages. Maybe the title that you see in the middle, it's the 13th element. Okay, it's talking about the early identification of phosphorus itself. There's a match at the bottom. That little circle is going to contain a picture of an alchemist who discovers it. And then maybe to help sales of the book, at the top, the sordid tale of murder, fire, and phosphorus. This turns out to be a very scholarly book that goes through the discovery, the various chemistry, the uses, the problems of phosphorus over the last essentially 4 centuries. So it's a very scholarly work, and much of the lecture will be taking you through pieces of the book to tell you about how it's relevant to bone and teeth disease. So here's that wonderful book by John Emsley. For some reason, there were 2 books published by him. This one showing the match, also published in 2000. And again, the title is The Shocking History of Phosphorus, a biography of the devil's element. So, what's phosphorus doing? It sounds nasty, but I haven't read through this book. The other one that I just showed you, both published in 2000, was a beautiful review. So you have these two books that are really taking you scholarly through the history of phosphorus and really up to the year 2000 in terms of its history. If you're really interested in this, I would start with those books. But the interest continues. This is by Dan Egan, published in just 2023. And the reputation for phosphorus continues to suffer. Here it's described as the devil's element, phosphorus in a world out of balance. How did we get there? Well, we go back about 4 centuries, and it's the era of alchemy. And the alchemists were interested to do something to find the philosopher's stone. I have no idea why it's described as philosophic. I don't know why it's a stone, but apparently in alchemy, if you get to this, you can convert base metals such as lead to gold. And this was an interest in Hamburg, Germany back in about 1669 for the alchemist Henning Brandt. And as was true of alchemists of that era, they had a fascination with human urine. They knew if you sort of boiled off the water, there were all sorts of different things in human urine. And they thought that, well, this is something we need to pursue because maybe the philosopher's stone is there. And then captured in this painting, sometime during the 1900s, the alchemist in search of the philosopher's stone discovers phosphorus. And this is in a art library, I believe, somewhere in Derby in England. And this could have been that individual who ended up cooking or heating up, maybe it was 15 gallons, not 15, 50 gallons of human urine. And as fires became hotter and as he had access to the money to do this, after heating and boiling off the water from maybe these 50 gallons, he saw in his flask um, a glowing presence that if he took it out of the flask for a while, it was sort of a party favorite where you could dip your finger into it, you could write on your buddy's palm, and at night the buddy's palm will glow thanks to the luminescence of the phosphorus that was contained. If you made a mistake and you took a pellet of this home and put it in your pocket, it sometimes burst into flames. Somebody took it and put it in bed with them under the bed sheets, and the bed sheets caught fire. And some people died of carrying elemental white phosphorus around. So what comes next? So here's the definition again of elemental phosphorus as capital P. And it was brought forward from the 1600s right to now because that property of luminescence proved incredibly valuable in making matches. And depicted here is, okay, the wooden stick with a red tip. And if you look at the box, along the side is something that's kind of sandpaper. But for safety matches, it's red phosphorus. And if you strike the head of the match on the sandpaper with red phosphorus, it will ignite. And this proved to be an incredibly important invention. There's the tip. It's sometimes called the compo, and I'll describe what the compo is comprised of as we go along. So here we are, Rare Bone Disease Echo program. And what I'm going to show you is how the experience starting in this 1800s, early 1800s, translates to rare bone disease in the context. And we know about avascular necrosis of the jaw, I'm going to show you Phossy jaw. We know about atypical femoral fractures, but I'm going to dig out the history about the bones of people who were exposed to what turned out to be toxic amounts of phosphorus vapors. I point out that actually the first complication of excessive and grossly excessive bisphosphonate exposure was a boy that we saw who developed as he was treated for unexplained leg pain and some elevation in alk phos, but at a normal skeleton at baseline, developed really after 2 3/4 years of high dose permidronate, the skeletal changes of osteopetrosis. Then came along avascular necrosis of the jaw. Then came along atypical femoral fractures. And I'm going to bring you back to this to stick with the rare bone context. So here we go with matches. And if you appreciated from the title of those books, the bad reputation that phosphorus was getting, it eventually translated into white or yellow phosphorus matches that were then called lucifers. Lucifer, a fallen angel, becomes the devil, I think, cast into hell, burning. And for some reason, the manufacturers of these first matches ended up calling them lucifers. So here you see superchlorate matches or lucifers, and they're being described, these being manufactured in Massachusetts, which instantly ignite by quickly drawing the sandpaper lightly over the composition, the tip, and warranting to keep perfect. So it's like, don't worry about these things. They keep perfectly. You just got to take one of these matches and push it over some sandpaper, and you'll be able to light your home fire, etc. So here's Lucifer matches. They were made possible in part because in the 1750s, the Swedish mineralogist John Gahn found that bone contains calcium phosphate. Here we go. Now we're in our realm of hydroxyapatite, calcium and phosphate. And therefore, you didn't have to cook gallons of human urine. You could find bones from cattle that contained phosphorus or phosphate, and this would then be used to make matches. In 1791, you had these things, Pallas candles, which were somehow chemically based, very cumbersome to make. Only the rich people could afford them. But rather than striking a flint onto steel to get a spark, they were able to get your fire going. And then in the 1830s now, phosphorus, elemental phosphorus, white or yellow, was added so that you're on your way to these lucifer matches. In approximately 1850, you had these white phosphorus matches. They were called lucifers. And for 80 years, they became the best-selling phosphate matches. They were appreciated. Herbert Spencer described them in the 1800s as the greatest boon and blessing to come to mankind in the 19th century. So just imagine how people used to start their fires at home. It would be flint, it would be maybe metal. You're clicking away until you get a spark. You need some shavings to get going. And now you could start fires for cooking, to heat the house, etc. That's why it's described as the greatest boon. And then by, I guess, the middle of the 1800s, 3 trillion of these are being used yearly. Eventually, red phosphorus will come along, and that'll be a friction match, like I showed you, a safety match. But the lucifers were not the benign things described on the box. They would almost spontaneously ignite and they became outlawed in 1910. So you've got a long history of these phosphorus containing lucifer matches. And then there's a company, Bryant and May, the East End of London, that manufactured lucifer matches. And in 1863, the British government put together the Children's Employment Commission. And they went into factories like Bryant and May, and they found that 50% of the matchmaking employees were children, less than age 12, some as young as 6 years old. And in 1864, there was a Factory Act, Extension Act, to get around this worrisome employment of children to make these matches. And here's a lithograph that depicts, what is it, a Lucifer match girl. So they wanted children not to be involved in making these. So how did they do it? Bottom of the slide. They decided they're going to hire young women to make these matches, and they'd take the wood sticks, maybe at home, dip the tip in sulfur, then the compo of the match head, which at the bottom contained glue, water, white phosphorus, potassium chlorate, and powdered glass. And that's how these things could be struck on a piece of sandpaper and ignited to make a fire. But I think, especially in Europe, especially the East End of London, less so in the United States, the factories themselves would look like this. There was poor ventilation. Maybe we had a bit more space in the United States to be making these lucifer matches, like in Boston, so that the prevalence, as I'll show you, of the jaw problem was a bit lower. But along the way, this is a woman who develops that swelling in her jaw, working as a matchmaker. And matchmakers' leprosy plagues hundreds of workers by, I suppose it's the latter half of the 1800s, with this depiction of what's gone wrong with the jaw. There's only a few specimens that exist left from that era, but look at the left mandible of this individual. Very few teeth, but you could see there's a horrible bone disease in the ramus, I guess, of the left mandible. So you go into this 13th element, John Emsley's book, and I'll read these to you because maybe it's the best way to convey the message. This is page 103. Quote, one of the saddest sights in the Odontological Museum of the Royal College of Surgeons of England is the display case that preserves the jawbones of some of the match girls. It is impossible to imagine the pain they suffered as the corrosive condition known as phosphorus necrosis eroded their teeth and gums to such an extent that it sometimes ate its way completely through the bone. One suffered described the pain as like continual rasping of a file. Page 103. Page 104, 1893, a case report. That's in the book. Quote, when she was 24, one of her wisdom teeth started to ache. A local dentist saw it was too decayed to be filled and pulled it out. The cavities left behind refused to heal, and after a few days, it began to discharge a vile-tasting pus, which gradually became worse until sometimes it oozed from her nose. Eventually, her jawbone became exposed, and one day a piece of it came away. The pain in her swollen face was indescribable, but she knew what the matter was. She had phosphorus necrosis, or Phossy jaw, as it was commonly called. And then the problem gets recognized, and it's kind of remarkable. Also, now on page 103 of the 13th element, there was a show, a musical somewhere in London, and it talks about a song that talks about top grade selectable, hardly detectable phosphorus. Taste is more subtler and spreads just like butter. grand. Phosphorus, phosphorus. Our special beauty cream. We look a proper dream, for we are minus a jaw. Governors don't charge a fee, give it away for free. Phosphorus, phosphorus. So I'm making the point here that this was recognized to be a problem by the latter half of the 1800s in the UK and in Europe. And it became known as Phossy jaw from white phosphorus. There was a 30-year history in the the phosphorus industry. The first case report was in Vienna, probably 1838. Commission was reporting 10 cases per year, 1 in 20 with this of those workers was exposed to phosphorus, and they became affected. There was exfoliation of bone, and Bryant and May reported 51 cases in 20 years. 9 died, age 32 years on average. So Phossy jaw, what made the disease so distressing was the fetid discharge of the victim's mouth, which was so objectionable that even carers and nurses would try to avoid those with Phossy jaw if possible. There's the prevalence, 0.3% in the US and 3% in Germany. I guess these are phosphorus workers or matchmakers. And 1862, the British Commission sort of considers the problem, and they recommend increased ventilation, wash your hands, have a lunchroom different from where you're making the matches, but nothing was done, as told to us on page 109 of that book. Then we go over to page 112. The most at risk were contacting Phossy jaw were in the men who made up the campo, the tip of the match, which contained around 5% phosphorus, and those who dipped the matches into a form of match heads. Chemical analysis of the vapor arising from the molten match paste showed it to be a mixture of 70% phosphorus pentoxide, 10% phosphorus trioxide, and 20% elemental phosphorus. So they were getting clues to what the chemistry of those matchmaking places were. And then they start to explore the European experience. So on page 111, there's talk about a representative from the UK going over to Belgium. During 25 years, Dr. Corins treated 30 cases of, this then becomes interesting. That's why I pulled it out from page 111. During 25 years, this physician treated 30 cases of spontaneous fractures of bone caused by muscular effort affecting exclusively in the lower limbs in workmen employed for many years either as dippers who had danger or in the dangerous departments, and who had also suffered from necrosis of the jaw. So I think all of the clinicians here now start to recognize, well, is there a similarity with avascular necrosis of the jaw and maybe even atypical femoral fractures in this history that you could pull out of this book on page 111. And then more, page 113, the panel had been told of their trips to Europe, on their trips to Europe, that the bones of those exposed to phosphorus fumes appeared to be more fragile, and that when these were broken, they also took a long time to heal. The medical opinion in these countries was that a condition coexisted, which they called phosphorism, and which was a weakness in some people, making them particularly susceptible, and also that this was especially true of those suffering from TB, syphilis, anemia, or were undernourished or alcoholics. So you'll see this almost becomes, yes, these folks had these other problems. They developed the phosphorism, and you'll see as I go along, with not too much time left, that it was almost, oh, if you've got these other problems and you work with phosphorus, you may get into trouble. The sale of Rodin, rat poison, ended in the UK in 1963. A little divertimento here. When the animals cruel poisons regulations came into force, after that date, cases of phosphorus poisoning in humans virtually ceased. Rodin consisted of a paste of bran and molasses, also known as black treacle, with 2% phosphorus in a finely divided form. A tin of the rat poison weighed 1 ounce, 28 grams, and contained 10 grains, 650 milligrams of phosphorus. A teaspoon would provide a fatal dose. So these rat poisons were also being used, shockingly, murder, to kill occasionally, or in suicide as another example of what phosphorus can do endogenously. The matchmaker story kept going. A fight for safer working conditions continues through the turn of the century. The Salvation Army existed at that time and called this phosphorus leprosy, and helped to bring the problem to prominence. And this then came out of the British government in the early 1900s, reports to the Secretary of State for the Home Department on the use of phosphorus in the manufacture of lucifer matches. This is a book that's 236 pages long, cost 11 pence when published. This was in 1899, end of the 19th century, by these gentlemen. And it came about, I think, because Queen Victoria was being told about the problem that was coming to these young ladies with Phossy jaw, etc. And she suggested to the government that they look into it. And they did. They went over to the continent to find out what was going on over there. What's the experience over in Europe? Continental authorities had called attention. This is the beginning of that document. Continental authorities had called attention to a tendency to fragility and fracture of the long bones and slow process of repair. And this observation, if established, would lend support to the hypothesis of wide constitutional changes, of which necrosis and fracture are accidental results. So the bottom paragraph talks about, oh, these folks often had syphilis, or they were alcoholics, or anemic, or had poor nutrition, bad teeth. They were set up for this phosphorism. But they did go to Europe, and they did report in this document remarkable insight into what was happening. Here's their page 81. 2 kinds of phosphorus employed in making lucifer matches: the yellow or white, the fumes from which are known to be dangerous, and the red or amorphous, used in the production of safety matches and generally regarded as no way detrimental to health. And they're talking about, in the manufacture of yellow phosphorus, only very few men are required. And it's interesting to know that the men who follow this avocation run, comparatively speaking, little risk to health. Although the years that the manufacturer has been carried on, the industry manufacturer has been, they've been remarkably free from danger. There having been recorded only 2 or 3 cases of serious injury to the health of workmen so employed. They're going to tell you in another visit to a different country that this was not so, and the men were equally prone to not only Phossy jaw, but these fracturing. They go to France. He draws attention to one very important fact. This fellow Arnaud, who's being interviewed, that it is that matchmakers may still develop symptoms of bone disease as late as 2 years after leaving their employment. So the bone disease is emerging. The fact that phosphorus necrosis is confined to the jaw is strongly suggestive, as already stated, of the phosphorus fumes acting locally. But then this Lorenzer, who first wrote upon this disease, believed that blood of the worker was the primary surcharge by phosphorus, and that his had an affinity for bony tissues. But at the same time, he admitted that the fumes acted locally. So now you're getting on to the systemic nature of phosphorism. In my report, he comes back to one of these three gentlemen, page 87. Upon the Belgian match workers, I allude to the fact that Grammont, which is one of the principal seats of the match industry of the country, this Dr. Brokorins met with them and treated in 25 years 30 cases of spontaneous fracture of the long bones caused by muscular effort, affecting exclusively the lower limbs of the workmen who had been employed for years in the dangerous departments and who had suffered necrosis of the jaw. This number 30 is too large for circumstances to be simply a coincidence. It points, therefore, to some peculiar effect of phosphorus and its compounds upon osseous tissues other than the maxilla, where the bones become extremely fragile. And the reason I'm showing you this is we know about avascular necrosis of the jaw. We know about the worries of atypical femoral fractures. But I don't think along the way with Phossy jaw and this sort of history being beautifully documented in these documents, this document that's over 100 years old, the combination was known. This accident is not unknown in our country. Dr. Garman of Bow Road, East End of London, informs me that he knows of 9 cases in which the long bones of the arm or a leg became broken in matchmakers. So, okay, I've got 10 more minutes. Dr. Coker's 55 cases extended over a period of 25 years. His observations are interesting from a medical point of view. He never found necrosis of bone apart from that occurring in the jaw. And yet, as showing how phosphorus induces fragility of the bones, he mentions the case of a matchmaker under the care who broke long bone of his thigh 5 times. So there were some that are saying, yeah, this fellow broke his thigh bone 5 times, but didn't think there was a strong association. So what happens then? Phosphorus was actually in medications. And recognizing what was going on with Phossy jaw, it starts to decline by the mid 1800s. Worried about Phossy jaw, but still in the late 1800s, France was using it. Some people in France were using it for some bone conditions. And then this book points out remarkably that in the 1920s, the Journal of the American Medical Association, JAMA, talked about below elemental phosphorus still regarded as a useful treatment. Why? Because it promotes bone growth. There's talk about it changing bone structure. Focal areas of dense bones were known. There was talk in the early 1900s about how it might be useful for massive fracture. Some even suggested, and I suppose actually made, a treatment for rickets, which was dissolving phosphorus in cod liver oil. And apparently, elemental phosphorus was in the British pharmacopoeia till 1932 and could be bought in some places in the UK up to the 1950s. So, okay, that's that story, but back to my interest in pedantics. Here is a very modern cartoon of the phosphorus cycle with fertilizers, pesticides going into our water. The microbial phosphorus cycle in aquatic ecosystems, again, phosphorus. You can go to the Cleveland Clinic website and come out with phosphorus, the bone fortifier. You can go on the internet and buy phosphorus tablets, at least by the way they're described. We hear about the top 12 foods that are high in phosphorus. Phosphorus in your diet. What is phosphorus? Phosphorus is a mineral like iron or potassium, and that's for your diet. And then you go and you look for how phosphate is being measured in blood. And what is a phosphate in a blood test? A phosphate in blood test measures the amount of phosphate in a sample of your blood. Then at the bottom, intestine, they control how phosphorus you absorbed from the body, from the foods that you eat. So if you go online and you look up a phosphorus blood test, some describe it as phosphorus is being measured in your blood. Some describe it as phosphate being measured in the blood. So we go back over 100 years, or now 100 years to Fisk and Subarow with the same sort of paradox and how this element is being described. I promised I'd tell you about spontaneous human combustion, something that I said to the medical students, if you had elemental phosphorus in you, you might suffer. And I don't know if this is pseudoscience. There are books written about it. You can go online to find out more. What is spontaneous human combustion? It's case reports, the mysteries of people in relatively good health who apparently, maybe sitting in a chair while smoking a cigarette, burst into flames, and they only found an unburned foot on the chair. And speculation that, oh, maybe methane was set off. But then there's also talk along the lines of phosphorus metabolism, how there are some phosphorus vapors that are not particularly flammable, but others that are extremely. So if you read about spontaneous human combustion, you'll hear about these case reports, speculation that phosphorus may somehow be involved. I go back to the medical students, and I'd have to say that no, you can have phosphorus in you, elemental phosphorus in you, but not burst into flames. It's not an argument uh, about elemental phosphorus. And the reason I say that is phosphorus, yellow and white, was put into medicines. You could get too much with rat poison and die from phosphorus ingestion, but they were also in medicine so that you didn't necessarily burst into flames. So I go back to those medical students, and I would now refine my description of phosphorus and what's happening endogenously based on that. So it's the business about spontaneous human combustion, a very hot topic. Here's a nice review of Emsley's book. The word phosphorus is derived from et cetera, and it talks about at the bottom, the 13th element discusses the theory of spontaneous human combustion. Yes, it does. There's a chapter devoted to it, resulting from phosphorus. It's interesting to note that most scientists and fire experts refuse to accept the idea of a spontaneous human combustion, but there are on and on and on. So, Phossy jaw. Pathogenesis, we don't actually know it, but it may be in addition to vapors penetrating carious teeth to the jaw, but also systemic involving the skeleton. No animal model. Interestingly, 1944, 7 men are reported with Phossy jaw in the British Dental Journal. 1960, 10 cases, British Journal of Industrial Medicine. 1946, despite good dentition, it's reported, and it's clearly inhaled, systemic, it seems spontaneous from white phosphorus. But importantly, for those of us interested in rare bone disease, bone fractures is part of it, and maybe from phosphorus oxide effects. So we know about the bisphosphonates. how Procter and Gamble in the 1960s, the detergent giant, then put water softeners into washing powders and then started to explore bisphosphonates, analogs of diphosphates medicinally. And I found it kind of remarkable. The chemistry of this is really fascinating. But look here, yellow phosphorus on the left. You combine it with water, and what do you get? You get pyrophosphate over there. So that's enough tease on all of this, and I'll stop here. I think on time.